Welcome to Inspired Caregiver with me, Michelle Magner. This is the podcast where people who are helping out their older family members come for information, tips, and inspiration on how to make their journey easier. Enjoy this episode of Inspired Caregiver. Okay, we're recording. You can hear me okay?
Yeah.
Awesome. Well, I'm so glad that you could join me for this conversation. I think it's really important. Can you introduce yourself and just give us a little bit of your background so we know who we're talking to?
Okay, sure. So my name is Sandy Carney, and I am an RN case manager currently with St. Croix Hospice. I graduated from nursing school in 2007 at the University of Nebraska Medical Center in Lincoln, Nebraska. And then my first job was with Madonna Rehabilitation Hospital, where I worked for approximately 10 and a half years, was brain specialist and a certified rehabilitation registered nurse. And I was approached by St. Croix Hospice in 2018. And so I've been doing hospice since 2018. So, yeah.
And at Madonna, the concept is that it's rehabilitation, so people are able to get to a point where they can go home.
That's the goal.
That's
bet.
the goal. Yeah.
Mm-hmm.
So hospice is just a different ball game. This is the
Yes.
end of life care.
Right.
Yeah. I feel like there are a lot of misconceptions about hospice.
There is.
Allison and I had touched on some of them in our conversation, but I think it just would be helpful from your clinical perspective. I think one of the biggest concerns is if someone makes the decision to admit to hospice that they are going to accelerate the dying process somehow through medications, or is that true or false?
That is a false statement. And I'm going to give you my reasoning why I do hospice and a true statement. So I live in Nebraska, and my grandma lived at the time in California. She's deceased now. And my grandma became ill, and she had been in and out of the hospital several times. And the doctor was using me, the go-between, while I was out there because I was the nurse.
Right.
And she called me and she said, I really think it's time to look at hospice. And of course, like everyone else, my heart kind of skipped a beat. But then I was like, I think you're right. So
even as a nurse, you felt a little taken off guard with that.
I did. Right. But I also knew that my grandma did not want to go back into skilled nursing and do rehab to come home. I knew she didn't want to do that. So I went in to talk to my family, and one of the immediate responses, I mean, everybody was, of course, more shocked than I was. They're non-medical. And one of the responses was, oh my God, mom's going to die in 2 weeks. And I went, what? I was like, why would you say that?
Right.
Well, because she's going on hospice. I said, no, that doesn't mean she's going to die. I said, it just means that she's not going to go back to the doctor and she's going to have support. And at the time, they were so overwhelmed, they felt like hospice care in California would be different than hospice care in Nebraska. So move forward. I did help my grandma get on hospice. And at the point of that, I was just so mesmerized by the hospice nurse, how much time she spent with my grandma and all of us as a family. And not only did my grandma get on hospice, but in 6 months, she graduated off hospice.
Dang, okay. So that's
So then she spent the next year, she had a bucket list. And one thing on her bucket list was to come back to Nebraska to see her great-great-grandson, which is my grandson.
Wow.
I wanted to see our home, which was honestly not, it was just an old farmhouse. Like it was not that big a deal, but those were her bucket list. Those were her items.
Yeah.
So she did. Her and her little boyfriend drove back and forth to California twice in that year. And then the last time she was here, I knew that it was probably going to be, um, whoops, sorry.
Okay.
I think I lost you there for a second. Please forgive me.
There you are.
There we are. I'm sorry. I can't stop the phone from doing interruptions, but
Okay.
anyways, but the last time she was there that October, I told my husband, I said, that'll be the last time we see her. He says, why do you say that? And I said, well, you watch and see. And when my mom got her back home, they drove back
Mhm.
to California and she got back on hospice. And then 3 months later, she passed.
Mm,
So hospice is definitely, it is about that last chapter in your life, but we definitely don't know how long that chapter is.
right.
Now, the goal isn't to graduate, obviously, but you never know what's going to happen. We don't know if it's going to be 1 week, 6 months, a year, 3 months. Nobody knows. For my grandma, it was 18 months. So it
So
just
it's not
depends.
like you admit to hospice and then you start morphine or other heavy drugs.
No, no. Obviously, depending on the case, if somebody comes on that has a severe metastasized cancer and they're in severe pain, then you're going to have to do things like that.
Mhm.
But the goal is comfort. And we have what we call a list of medications that are our comfort medications.
Mhm.
And we go over those at admissions, but then we tell them this is the bag that you put in the back of the refrigerator and we'll tell you when we need it.
Okay.
And then it just sits there until the time comes.
And so what's in the bag? Is there like
So,
something
I
that
mean, that would be like where your morphine is,
okay.
which morphine is used for pain and shortness of breath,
Okay.
or lorazepam. Another name for lorazepam is Ativan
Mhm.
because sometimes during um, the last few days of life, people have anxiety and restlessness. And so then we schedule lorazepam. And then, of course, with morphine, you can get constipation. So in our bag is some Biscadil suppositories,
Mhm.
some Senna. Morphine can cause nausea. So then there's ondansetron. Another name for that is Zofran. Someone might know that name
Mhm.
better. There's also hyoscyamin, which is for secretions, because as we get closer to end of life, we don't have the strength to swallow.
Mm.
It's very scary for families. So it's like those secretions, they're stuck between, the top of our throat and the
So
bottom of our throat.
the gurgly sound?
That's the gurgly sound.
Okay.
So if they had the strength to clear their throat, it would be gone.
Mhm.
But they don't. And so you give them that to try to dry up those secretions. It doesn't work for everyone, but some people, if it does, that's great.
Mhm.
Another one is haloperidol because unfortunately, sometimes people in the life have delirium or hallucinations. And so you can treat that with haloperidol. And then of course, oxygen. We use oxygen for shortness of breath. And all of this is about comfort.
Mm.
We may not use any of those medications, or we may use a little bit of all of those medications.
Mm.
Every person is completely different, completely different.
So it's for comfort. It doesn't accelerate anything. It's like
No,
if there's pain, then you would admit, like if you have a headache, you would take a Tylenol or
right.
ibuprofen. If um, I mean, we're both familiar with the waterfall of medicines and prescriptions that people can end up on just in life. If
Yes,
you have one ailment, and then that causes a side effect, and then you take. But so each of these treats a very specific thing,
right.
specific
In
purpose.
fact, Michelle, I will tell you that honestly, most of the time, I get these poor little elderly folks that it's time to go on hospice. They're on a plethora of medications,
Mm,
and when you start taking them off of a lot of those medications, they actually do better
yeah.
for quite a while. You know, um, sometimes, I mean, I've admitted people on 30, 40, 50 medications,
Oh,
and it's that's a lot of medications.
Yeah.
But you start deleting some of those out and they start feeling good. And we always kind of have this little saying at our every 2-week meeting. I said, well, Dr. Hoberman, you fixed another one because you get them off those medications and they feel better. So
Yeah.
yeah,
It's something to pay attention to as a family member, e
absolutely.
especially if you're an at-home caregiver, and you're the one who is having to dole those out throughout the day. Just being aware that every medicine we take has, a a positive impact. Like, it was prescribed for something, but there's potential side effects that you need to pay attention to.
Right.
Yeah. So I'm curious about like how the body shuts down. I think this is a really
Hmm.
hard, obviously emotionally charged, challenging time for people. And so as little things start to change, like maybe the feet change color, or
Hmm.
the hands feel differently, or like we were talking about the gurgling,
Hmm.
just if there's, I mean, I don't want to say like checklist, but kind of just what are sort of the order of events? My understanding.
So,
Yeah.
that's probably the scariest part for every family member, I think. Number one, there's no order and
Okay.
everyone's different.
Okay.
There's all these different things that can happen, and none of them might not happen.
Okay.
That's the hard part.
Yeah.
The body shuts down from the brain downward. So, there's the confusion, that's definitely there. But typically, as you're working towards getting towards end of life, your loved one, you'll notice, boy, they sure are sleeping a lot.
Mm,
That's probably the first thing. They're going to be sleeping a lot. Or they could do the opposite and just be very restless and not be able to remind you of someone that just can't get comfortable, and that's just called that terminal agitation, and that's what that lorazepam's for. So
okay.
just to help them get comfortable, they don't want to eat. And the way that I try to explain that, eating is a very social event for all of us. So that's something that we all come together. We love to talk about our day, what's been going on in our life. And so when our loved one is not wanting to eat anymore, we feel like, oh my gosh, we're starving them.
Yeah.
This is mean. I can't do this. But honestly, you or I, when it's time for lunch, we get that nudge in our belly that says, oh, I need to go eat some lunch. They don't have that anymore. They don't even have the feeling to want to eat. They don't want to eat. Most foods don't taste the way they're supposed to taste. They
Hmm.
don't smell the way they're supposed to smell. There's no attraction towards the food. So, and that's just part of the body shutting down. So you're definitely not starving them. You can offer,
Hmm.
but if they don't want it, don't force.
Okay.
Just leave it alone. Um, a lot of times their urine output is going to slow down because if you're not drinking, you're not going to have a lot of output. Their
Hmm.
bowels are going to change. But the hard part, I think, for people to understand is that, my mom hasn't had anything to eat or drink for 5 days, but yet she's still having a wet brief, or
Right.
she had a bowel movement yesterday. Even though our body is not eating or drinking, believe it or not, the body still produces urine and feces.
Mm.
And so, we still have that. That still happens.
And so, like, naturally, we think, well, the urine and feces are a product of the food that we're eating, so it's confusing when that's not the case.
Right.
Yeah. So what about like appendages and hands and that sort of thing?
So, um, it doesn't happen to everyone, but there's a terminology called modeling. And modeling is when your fingers, your hands, your feet, your legs, your arms, all of it turns a discoloration of like a kind of a dark color towards a bluish purple.
Mhm.
And that's the blood is not getting to that area. It's just everything's shutting down. Typically, once a person models, they are just hours from passing
Okay.
most of the time. Yeah.
So
So,
we talked a little bit about food. What about ice chips? Because I know there's like the little sponge popsicle. type things that sometimes people will use for moisture?
I'm sorry, I couldn't hear you.
How important is like the moisture, like ice chips or the little
Usually what we use is what they call touthettes. That's what, yeah. So, and we just dip them in water and we go around their teeth and on their tongue a little bit. Um, we refrain as long as they can swallow, we'll let them do sips of water if they want it, or sips of their favorite juice or their favorite pop. Or
yeah.
I've even dipped touthettes in Diet Coke. I mean, whatever their favorite is, I mean, they get what they want. I always tell them this is your ship, whatever you want. So, but once they get to where they can't swallow, then you don't want ice chips. You don't want to use straws. You don't want to do any of those things because they will choke.
Mm,
And then, of course, that's very scary.
mhm.
So, yeah. So you want to refrain from those things.
So, are there any other things just as the body is shutting down that people could be looking for to know, um, to find like things that you know that we don't know?
Sure. So I think one of the biggest questions, how am I going to know my mom's in pain? She's not talking anymore.
Yes.
So there's other things that you can look at. So like if their respirations become really fast, so anything past 28 to 30 respirations, there's probably something going on. They're uncomfortable in some way. And that's when you could give that morphine. Um, and morphine, like I said, we use it for shortness of breath and for pain. And I will tell you, I've been doing hospice nursing for 3 years now, and we use morphine more for shortness of breath than we do pain,
Hmm.
because there's not a more panicky feeling than the
Right.
feeling of not being able to breathe.
Right.
So and I've walked in to a facility before and seen a patient with their respirations at 40 respirations a minute. And it's like, oh, we need to get some morphine. We need to do something here. This is,
Mhm.
and they have their eyes are big and they're scared. They're scared,
Yeah.
you know, or if they're kicking their legs around and kicking their arms around, they can't talk,
Mhm.
but their body is telling you something's not right, something's not
Mhm.
right, or my mom's just been moving all over today. I turn her to her side, I turn her on her back, I turn her on the other side. I just, you know, they're uncomfortable. There's other things to look for, or a grimace on their forehead. If, they're showing a grimace, a
Mhm.
frown, then they're hurting. They're probably hurting, you know. I've had family members are so afraid of morphine, they're not in pain, they're just thinking,
Hmm.
"Well, okay, but what if we try this?"
Mhm.
So, I mean, everyone's scared of morphine. It's just got such a bad name, but it is such a comfort too. So,
What are some of the non-pharmaceutical options for comfort? Like what?
so I have had lots of families use, like, especially, essential oils are very big. Lavender for relaxation,
Mhm.
or if you're trying to have your loved one be more alert because you want to talk over old times or something, peppermint is always a good one. And peppermint helps with soothes with pain, things like that. You can always use ice packs.
Okay.
Um, Repositioning is always a good thing to do. Um, try to stay away. I mean, I know elderly hates being cold. They hate it. And so they want heating pads. But what heat does is it dries out joints. So it'll feel good when you put it on.
Mm.
But then when you take that off, it's going to make the pain sometimes 4 times worse than it was before you started. So
Okay.
ice is actually better. There's pain patches we can use, like lidocaine patches. They're over the counter.
Mhm.
Those can help a person. A lot of times, low dose morphine, and then you have them take Tylenol with it, so then you've got morphine is quick acting, so it's quick in and quick out, but the Tylenol will help carry them longer. That's another idea you can use.
Okay.
Um,
Pillows,
just
like I see people with pillows stuffed around them or
Mhm. Right. So because they are not moving the way you and I are moving, so you definitely want to prevent sores.
okay.
So you use pillows to prop them on their sides, pillows between their legs, pillows at their feet so their heels aren't just sitting on the mattress,
Okay.
because they're not moving around like you and I do, so that's pressure points. And they've lost a lot of weight, so they
Mhm.
have all those little bony prominences,
Mhm.
and so that's a good place to start a sore. So yeah.
What about temperature? Will there, because I know I've seen people that look like they feel hot.
Right. So a lot of times people will carry a fever when they're going towards end of life. And right away, someone in the family will say, oh my gosh, they've got an infection, but it's not. So in the back of our neck is what we call the hypothalamus, and that's our temperature gauge.
Mm.
And just as everything's shutting down, that temperature gauge isn't working the way it's supposed to. So they can either be too cold or too hot.
Mm.
And so, typically, as they're getting towards into life, grandma that was cold all her life, all of a sudden, you want all those blankets off because
Mhm.
she's not going to like it. She's going to be pretty hot. So, yeah, but that's what's happening.
So that, I mean, that's such a good point. Like, she's always wanted all the blankets on and to be cozy, but if she starts kicking them off, not to
Right,
fight her
right,
with that.
right.
Um, what about if they're unable to speak? Can they still hear?
Yes. So they can hear you, and you'll get little twinges of responses like their lip might move or their eyebrow might rise,
Hmm.
but it is very true. The last thing to go is the hearing.
Okay.
So, I have loved ones that read to their loved ones, or they talk about old times, or mom, I just remember when we did this, this, and this, or, guess what? You talk to them about their day or what they've been doing. They're hearing all of that,
Okay.
all of that. And I always offer, I tell the families, we're getting close. So if there's anyone that needs private time, this is the time to take it because she can still hear you.
Mm.
So if there's anything that you feel like you need to say, now's the time to say it.
I know frequently people will find comfort with spiritual readings. So if
Yep.
you were a Christian person, to have the Bible read to you
Yep.
would feel comforting. And what about like music?
Right. So, of course, with COVID, it's been extremely difficult,
Yeah.
and loved ones can't always get into facilities. And so, lots of times we read out of the Bible their favorite scripture,
Hmm.
or that's where iPhones are especially like as bad as technology can be for us, but it's great. And you go to YouTube and you find their favorite line of music. I mean, I took care of one patient that his favorite band was Kiss. So we played a lot of Kiss. And then I've had, the gospel hymns, and I just turn on my iPhone, I play it really low, I lay it on the pillow by their ear, and I just hold their hand and just play it as long as, they love it. They just love it.
Yeah. So how important is that physical touch? Like, do some people that are dying want it and others don't?
Right. So if you're going to touch them and you feel them pulling back, don't push.
Okay.
They don't want to be touched. But if you go to hold their hand and they're squeezing, they want to be touched. I
Okay.
mean, sometimes you don't know. So it's your instinct. Do you have to? Not necessarily, but just talking to him and letting him know that you're there and it's okay.
Yeah.
Um, that kind of leads into that when they're in that comatose state and they're not able to talk, is that you always want to give permission because they moms and dads don't want to leave their babies, and you know it doesn't matter how old they are and
Mhm.
how old you are, they just don't want to do that, which leads me to another. I mean, I'm just going to go right into another thought, is that so many of the family members say, I can't leave mom's side, she can't die alone.
Mm.
There are a lot of folks that they want to die alone, so you can be there 24/7, and that time, which I have had happen more than once, you get up to go to the bathroom and you come back and they're gone
Yeah.
because that's what they wanted.
I That gives me chills because both of my grandmothers, I was the primary family caregiver. So both of my grandmothers waited for me to leave.
Yep.
And I was about 30 years old the first time and about 36 the second time.
Mhm.
And I was sad. I
Yep.
felt sad. I felt, and with my both of my grandmothers, their favorite aide in the facility that they lived in was with them.
Aw.
So, which is really was part of a big reason why I went to work in senior living was because I just know how important and the impact and the love that the
Yep.
aides have for the
Yep.
residents. But I was relieved to know that they were not alone. But I hear you that sometimes people prefer that. That's what they want,
Right. Right.
and we don't get a
Right.
choice.
Nope.
I felt
Nope.
like I missed out. That's the truth.
Right. Or people feel guilty, "Oh my gosh, I let my mom die alone." Or in your case, "I let my grandma die alone." You didn't let her do anything. Number 1, it's God's timing.
That's
There's
right.
not anything that we can do to control that, and it's her journey,
Yep.
not ours. So, yeah.
Darn those women, they were so independent and headstrong. I just and we like with one of them, her last meal was we had, a beer and C's candy.
There you go. I had a gentleman that I took care of that whiskey was his choice, and so we dipped his totheads in whiskey
Yeah.
so he could have one last toast with his friends.
Yeah, that's
Yeah.
beautiful.
Yep.
Well, what are your anything else that we're just missing for to information that you would have that would provide families comfort?
I think, um, I've been on the caregiver side and on the professional side.
Mhm.
Um, it just ask lots and lots of questions. Um, as a professional, we get caught up in our medical jargon. Don't let us do that.
Okay,
Don't allow us to get away with that.
good.
Um, I cut myself off all the time and say, "Oh, I'm so sorry. This is what I meant."
Mhm.
You know, um, or there's never, I never ever make my loved ones feel every question is important. There's not a single question that's not important. I
Yeah.
do this every single day, day in and day out. I know how to go in and turn them and freshen them and change them and do this and that. I know how to do all those things.
Mhm.
But when all of a sudden your loved one becomes terminal and now you have them in your home with this hospital bed and you have all these supplies over in the corner and you have all these medications in the other corner and now you have this list and now you have these times, it's very overwhelming.
Yeah,
It's scary. It's all very scary. So don't just ask lots of questions.
it's so good. I
Yeah.
think the other thing is to remember that frequently hospice companies have bereavement programs.
Yep, we do.
You do. So that after the fact, there are
Right.
support and options for family members because when you are so intently involved in helping somebody and then they're
Mhm.
gone, that your identity
Changes. You
changes
bet.
and you start to feel a little lost. Like you wake up
Yep.
and you had your whole routine and now you don't have that. So,
Right. I know that with St. Croix, our bereavement team follows for 13 months because we want to get past that 1 year mark. It's very important.
yeah.
Um, and we know how important that is, just exactly what you said. You had this routine. You did this day in and day out for 2 months or 6 months or,
Mhm.
whatever. Now all of a sudden, or your FMLA's up and now all of a sudden you have to go back to work.
Right.
And, it's just a big shock. Yeah. Bereavement's very, very important.
There's something else that I forgot to ask you about with the body.
Okay.
Breathing patterns. Like
Mhm.
there could be a breathing pattern change, and I know there's even a term for it, and I can't remember it.
Cheyenne Stokes.
What is it?
Cheyenne Stokes.
Yes. So can
Okay.
you just share about that?
Not everyone does that.
Okay.
Um, so I have seen people carry on for 48 hours with 2 to 4 respirations a minute. Like that is not abnormal. Um, it's everyone's own ship.
Mhm.
So this is their journey. Or their respirations can be perfectly normal and then
Mm,
all of a sudden stop.
mm,
I don't want people to be afraid that like, is there going to be this big traumatic, dramatic, and it's tip no. Either they're just going to go to sleep
mhm.
or they might go, and then that's it.
Okay.
But it's not going to be this like what you see on TV.
Okay.
I guess that's probably the best way to say it.
Yeah.
Um, but the Cheyenne Stokes is can be very loud and it's like it makes you think that they're choking, but they're
Mm,
really not. And that's just part of you're getting close. My grandma did those and
mm,
you're getting very close to death. In fact, she did that for about 30 minutes and then 15 minutes later she was gone.
mm,
So some people can do Cheyenne Stokes and then the next day they're not doing Cheyenne Stokes
mm.
or the next hour. I mean, everyone's completely different.
Okay.
So yeah.
And that's more of a shallow, rapid breath? I guess if people
Yeah,
Google it, they can
yeah.
yeah.
So it's got a really loud noise to it.
Okay.
I don't even know how to explain it,
Yeah.
but YouTube,
Yes.
you can always go listen to it.
Yes. The teacher of all things.
I know. If you don't know how to do it, YouTube
Go to
it.
YouTube. Yeah. Well, I
Right.
think this has been a lot of really good information. I think it's been really helpful. I think like I said, it's so emotionally charged and
Yes.
scary. And even when you're anticipating death, it's so final. So when they do take their last breath, are who are people directed to call, and when do they need to call? Like,
Mhm. I think, every state, I mean, and every company has I think their different standards.
okay,
For us, you call us and we come out and we take care of everything.
okay,
So, in the state of Nebraska where I live, you have to call the coroner first, make sure it's not a suspicious death. That's the law here. And then you have to give all your information over the phone. And then I always ask the family, we can stay as long as you want. You can have as much time as you want, but when you're ready, I will call the funeral home.
okay.
Um, and then once I've called the funeral home, then I ask everyone to give me some time because I want to give them a bath. I want them fresh to go to the
Mhm.
funeral home. And then I always walk them out.
Okay.
So, yeah.
Well, thank you for your time.
Oh, you're very welcome.
I appreciate it. You look amazing.
Oh,
YouTube ready.
okay. Oh,
Oh, well, thank you.
all right. Thank you so much, Michelle.